Hi, everyone. My name is Dr. Ananya Banerjee. I'm assistant professor and the Equity, Diversity, Inclusion, and Anti-Racism lead at the School of Population and Global Health at McGill University. I'm extremely honored and excited to be here in front of all of you to talk about my passion project, Principles of Belonging in Global Health, as part of the WomenLift Health program. A question I pose to all of you in the audience is how global is global health? Based on the facts that 95% of Masters of Global Health programs are located in high-income countries, 85% of global organizations active in health and health policy, like the World Health Organization, have headquarters in Europe and North America. A few months ago, my colleagues and students in global health came together to write a compelling piece in The Lancet titled, "Are We Training Our Students to Be White Saviors in Global Health?" Given 80% of global health leaders are nationals of high-income countries, and of over 90% of whom completed their education in these economically rich countries. The objective of this interactive equity and anti-oppression workshop is for students in high-income countries to understand the nuances of decolonization, intersectionality, positionality, privilege, and oppression in the political and historical contexts globally. This is a training that has been requested and advocated for students over the years. We essentially wanted our students who were part of this training is to critically think about how global health inequities are created through systems of oppression, to consider the vast methods, interventions, and future directions that are really rooted in decolonization, to advocate for global health justice that is incremental and transformative. And we wanted our students to engage in and facilitate difficult conversations that promote unlearning opportunities and, most importantly, solidarity in global health. To date, we have over 700 diverse undergraduate and graduate students who have received this training across North America since 2023 of September. We've also adapted this training to students in programs such as medicine, public health, and pediatric care. Among all of those who participated in this training, about 100 completed the evaluation. 88% reported the workshop provided them with new knowledge on equity and anti-oppression concepts that could be applied to their current studies and future careers. What students are saying? They said this training is eye-opening. It raised their awareness of the importance of developing an inclusive mindset. They found the training refreshing and inspiring as part of a global health curriculum, and really enjoyed the fact that the global south is not always helpless. I want to acknowledge our core team who designed this training. This training has really been driven by our students, such as Vivian Chang and Josh Swain. I'm really grateful to the WomenLift Health program. My journey in the last 12 months has been absolutely incredible. I think the women and I who were part of this program created incredible bonds. And I think we all realized together that we are our mother's dreams fulfilled, our grandmother's vengeance realized, patriarchy's worst nightmare, a testament to the power of anti-colonial resistance, as said by Dr. Lorea Garcia Pena. And I'd really like to acknowledge my mother, Namita Banerjee, and grandmother, Shanti Rani Chatterjee, as this program has deeply connected me to my roots and to carry their incredible boldness and strength as women of color. I would like to thank everyone who's been instrumental as part of the WomenLift Health program, such as Shireen, Jessica, Morgan, Alistair. I'm so grateful to my mentors, Lisa Dare and Dr. Maureen Litchfield, and most importantly, Dr. Madhukar Pai for nominating me to the WomenLift Health program. And lastly, but not least, to my students, you are the heart and center of my career. And I really, really look forward to working with all of you in the audience to really scale up this training that can be offered to students globally who wish to study and work in global health and beyond. Thank you so much.